introduction to basic life support, which is CPR. What do you mean by life support? So, life support is a series of emergency procedures that are carried out to prolong the life of the victim with life-threatening emergencies. So, meaning these are procedures done during an emergency situation, and this is actually carried out. This is done in order to save a victim, especially those with life-threatening situations. So meaning those are victims who could die if help is actually not provided or help is not given to the victim immediately. Now, there are different kinds of life support. So first, we have the BLS, or the basic life support. Second is the ACLS, or the advanced cardiac life support. And the third one is the prolonged life support. So sa ato ang module, we will be focusing on the basic life support. Okay, so what is ACLS? This is the use of special equipment to maintain breathing and circulation for the victim of a cardiac emergency. So when we say the use of special equipment, this will only be given or provided in our hospitals, in a hospital setting. So that is when ACLS happens, okay, or when ACLS is actually given to the victim. While when we say prolonged life support, this is actually for patients who actually are on are given post um, post treatment. Let's say for example they were already given treatment in the hospital, and then they need for the victim to be able to still maintain life, to still continue to survive. So there is what we call the life support, di ba? Naka machines na lang ang nagdala sa ila. So that is what we call prolonged life support. So still, it's provided sa ato ang hospital setting. Okay? So those are the three kinds of life support. So, siya. So, what do you mean by basic life support? So, what is basic life support? Again, as I said, this is the type of life support in which we as first aiders will focus on. So, it is an emergency procedure consists of recognizing respiratory or cardiac arrest or both in the proper applications of CPR to maintain life until the victim recovers or until ACLS is available. So, emergency procedure which consists of recognizing or determining if the patient has respiratory or cardiac arrest. Respiratory arrest meaning it is now the respiratory system who failed to function. Or could it be cardiac arrest in which the cardiovascular system is the one who failed to function, or even both? Okay, so this is now the application of cardiopulmonary resuscitation, CPR. So this is what, so basically, basic life support happens as we apply CPR to the victims. Okay, so we apply CPR until ACLS arrive or until the medical team arrives. So that is BLS, or basic life support. Now, giving the BLS requires one or more life-saving skills. So what are the skills that we need to have in order for us to perform BLS properly? Okay, first is the use of an AED. Okay, so I've already mentioned AED no sa ato ang class. So later we will try to review what is the proper way of using the AED and what are these different parts of the AED that we need to put onto our victim. Next is your skill in doing chest compressions. So when it comes to chest compressions, it is very important that you know no the proper positioning of the hands, diba? The cycles, the number of compressions, the number, okay? So the number of compressions that you need to give to your patients in one cycle, and also the depth no, of compression, and which will also differ. So it will also depend if the victim is a baby, if the victim is a child, or if the victim is an adult. Okay. Another skill is rescue breathing. So we as first aiders, it's very important that we know how to provide rescue breathing. So what is the very important thing that we need to focus on when we give rescue breath is that we are able to open the airway properly. Because when you give risky breath, it will be very useless. Useless ra ang air nga imong i-give if you are not able to open the airway because it will never get through. Okay? And of course, choking care. So choking is another emergency situation which could also lead to the victim being unconscious. So we also need to know what is the proper way of managing choking. Okay, how do we manage a choking baby, a choking child, or a choking adult? So these are now the four very important life-saving skills that we need to have. Now, what is an AED? AED is an automated external defibrillator. Automated external defibrillator. So it is a device capable of analyzing the heart rhythm and providing electric shock known as defibrillation, okay, to the heart in order for the heart to beat regularly. So during an emergency situation, before you are to give CPR, if you are able to acquire an AED, the better, because you will be able to provide shock to the heart and then you give CPR manually. Ba? So as you do your emergency scene management, guys, it will always be a part of the procedure, the step-by-step procedure that you need to request for an AED. Okay? Why? Because this is a device who is able to analyze the heart rhythm. Siya ra ang maka-go through, no? Maka-check if the heart is actually if when it comes to checking the rhythm of the heart. Okay? If the heart needs a shock, no, o kundili na. Okay, so Sierra, so this device is the only one that could analyze the heart rhythm. And it is usually done before doing CPR. So before you will be giving CPR, if you are able to acquire an AED, you get one. Okay? Now, there should be proper placement because it has pads, no, in which you will need to put on the chest of the patient or at the back portion of the body. Now, if it's an adult or a child, no, you can put, so what is the tip when it comes to putting or the proper placement of the pads? So, um, you don't need to worry actually because in emergency situation, there are really times that we get so confused, diba? Our focus is affected. So you will know because the pads are actually labeled as the right and the left. So you will know if it's the right or the left pad. So the right pad is usually placed at the upper right portion of the chest, and the left pad is actually placed at the lower left portion, no, of the breast. So upper right, lower left. That's for an adult or a child. But if it's a baby or an infant, then it has to be placed. One is above the chest, no? The right pad is above the chest. The left pad is placed at the back. So the positioning of the pads actually is very important in order to sandwich the heart once the device will give its shock. Okay, so it needs the shock will it has to sandwich the heart. So dapat naan sa middle si heart para ang shock no will be given adto directly sa heart. Okay, so proper placement is very important. Now, this is how an AED looks like. So you will see there's a pad, diba? And that's the device. So the pad is then connected to the device, and then you put the pad first before you turn on the device. Okay, once the device is turned on, hands up. You don't need to touch anything. You just have to wait for the voice prompt. Okay, so if the voice prompt says it will provide shock, then the red button will light up and you'll have to press on that red button. After giving the shock, then the voice prompt, another voice prompt will be heard. If it will ask you to give CPR, then it will prompt you to do CPR. Okay, so that is now your AED. You have here the steps now, so you turn on AED power again. Make sure you have already positioned the pads before you turn on the AED power, and then you follow the voice prompts. Expose the person's chest. Do not forget, no, you do not put the pad over the clothing. Okay, so you need to expose the chest. Make sure that the chest is dry. You wipe it dry if it's wet. If it's wet with sweat, no? So if there is blood stains, so you just have to wipe it off. That way, the pads will be placed properly. And then you remove jewelries, whatever are those metal sources that is actually worn by the patient. It has to be removed. Now, you check the bracelet if there is an identifier, especially for those patient who underwent mga surgery, mga knee surgeries, no? Kanang mga metallic na ang mga knee, or nanabad yun na siya yung mga kanang pacemaker, ingon ana. So it has to be checked. Now, place the sticky pads, press on the analyze button, and let the device analyze the heart rhythm. And then, if prompted, push on the shock button, and then you continue CPR if possible. That is, if it prompts you to continue CPR. Okay? So, is how to use an AED. Now, there are special considerations when using the AED. So, first is water. No? Is the patient located? Were you able to? Is the patient lying on a water surface? Is it a child? Does the patient has medication patch or implanted devices? So these are now the special considerations that you need to check. Okay. So, um, these are now the steps on how to use an AED on a child. So, I've already mentioned it earlier, no, that if it's a child or if it's an infant, the pads must be placed, no, one in the front of the chest and the other one should be at the back. Okay, so this is now the picture. Right. Now, on our next video, we will then continue. We will now be talking about chest compression, which is another skill that you need to have in order for you to properly perform CPR.